love me. Tell me pretty lies, look me in the face. Tell me that you love me, even if it's fake.
Hey all, thanks for tuning in. Welcome to my channel, Holistic Beauty RN. If you're new here, welcome. Thanks for coming. Have a seat and learn some useful information today. So for those of you who are new, I am a registered nurse, and a question that I get asked a lot, especially during this COVID-19 pandemic, is what are the differences in the masks? So you have your N95, your surgical mask, and then homemade masks, which could be made out of different typical fabrics such as cloth, cotton t-shirts, bandanas, what have you. So a lot of people tend to ask me, like, what are the differences between these masks and what are the most effective and things like that. So today, in today's video, I definitely want to address what are those differences between those masks and what are the effectiveness of each. So I'm going to start off by showing you guys what is the, as we would say, the cream of the crop for masks, right? Especially during this COVID-19 pandemic, a lot of people want to know what's the best way to safeguard themselves, especially when it comes to protecting them from this virus. So first and foremost, the COVID-19 is a virus. It is it's classified in the SARS virus category. So basically it's a group of viruses, a group of coronaviruses as they may be known. And a lot of these viruses, for instance, can lead to different respiratory ailments such as the common cold, the SARS respiratory virus, COVID-19. So they're all a part of kind of that same strain, but they can lead to different illnesses, different manifestations as far as symptoms of that virus. So the one that I'm going to be focusing on for today's video is, of course, what's prevalent now, and that is the COVID-19, aka coronavirus, which is airborne, meaning particles spread in the air either through somebody talking, coughing, sneezing. They produce those droplets. They can be transferred through inhalation of those particles, which are lingering in the air after you sneeze or cough or talk, anything like that. Okay, so first and foremost, our N95 mask. So this is how it looks like. There's kind of different variations as far as different looks of it, but this is the most common one. This is by 3N, and I don't know if you can really see it there, the N95 masks. So with the N95 mask, these are respiratory masks, okay? So these provide a close facial fit. I don't really want to put it on my face now because you'd have to put it like over. Actually, you know what? For the sake of demonstration, let me go ahead and show you how it looks properly on. Okay, so I've got the two strings here, as you can see. So this brim here goes over by the nose. As you can kind of see, it's kind of pointed up, whereas the bottom chin part is more rounded. So you would take the two straps, put them over. You would have one strap that goes to the back, the other one which kind of remains at the top, and then you would just kind of adjust it like so. So with the N95 mask, these are respirator masks, okay? So these provide a close facial fit. As you can see, there's really no air getting in and out. Especially if you guys were wearing this, you would be able to tell if you're feeling along the sides of it, there's no air in and out. It's very effective filtration system, prevents even the smallest of particles that can be measured 0.3 microns. Now, a micron is very, very small. So it allows for particles that small not even to be filtered in through the system as you're breathing in and breathing out. Okay, so these can block very small particles, specifically airborne particles, and those associated with COVID-19 or coronavirus. So these are very effective. However, the CDC does recommend that these be reserved more so for healthcare workers, those in direct contact with COVID-19 patients. So they're not recommended to be worn by the outside or general public. Now I have our surgical mask here. So this is what that looks like. So you've got the flexible, pliable nose brim here, then the bottom part for the chin, and then you've got your two bands here that would go around the ear as so. So I'm going to go ahead and demonstrate how that looks. So this is the wrong way to wear it. A lot of people wear it like that, so I want to just show you guys that is not how you wear it. Make sure to pull it up above the nose and go ahead and press down on that nose part to ensure that it is shaped along the bridges of your nose and face. Okay, so this is how it would look on. So these are the surgical masks. So this is what a lot of the times you'll see people wearing on the outside, or even nurses or healthcare workers, first responders, things like that. People who may not necessarily have direct contact with COVID-19 patients, but just to have something, you know, this is what they would wear. Surgical masks can block large particles, splashes, sprays, or splatters, like from a sneeze. These particles can obviously be either from the outside, you know, somebody sneezing and you're not breathing it in, or from you yourself sneezing or coughing. These particles are not transferred from your nose to the outside of the mask if you're wearing this or while you're wearing this. So this prevents any germs, inhalation of germs, from like common cold viruses, things like that. It keeps your saliva and respiratory secretions from others, like I said, or theirs from you. However, these don't, compared to the N95 mask, these don't filter small particles. So if you're going to ask how effective are they in preventing you from transmitting or getting COVID-19 from someone else, they're not effective. However, they do provide a basic means of protection as far as from you spreading germs or receiving it, especially if you're not necessarily contagious with the COVID-19, but it does offer some form of protection. Okay, they don't provide complete protection due to the loose fit. As you remember when I'm putting this on, there's still areas here which are not tightly fitting like the N95, so that still allows air transmission to get in. And obviously for airborne particles like COVID-19 that pass through the air, if you're allowing that free air going in and coming out, you're putting yourself at risk, and you're more than likely at risk for contracting COVID-19. So it's not effective against small particles because it doesn't have that close fit as the N95 would. Now, last but not least, I have your typical cloth mask here. So this one is just made out of a typical like cotton fabric. As you can see, just basic fabric, and then it's got like some bands here for the elastic ear, or elastic bands to go over the ear here. So this is how that would look. There's really no piece in there to kind of help provide that bend around the nose. It doesn't have that. So these are your basic cloth facial masks here. So the CDC does recommend that the general public do wear cloth masks, and obviously reserve like surgical mask and N95 masks for healthcare workers and first line respondents, people like that. It's because it will at least prevent the spread of infection as far as, you know, you coughing or sneezing. You know, there's at least some barrier, which is the key takeaway here. There is some barrier between you and vice versa, someone else's, from spreading inside to you. However, it is better than nothing. And all this information I've gotten from the CDC website, which is the Centers for Disease Control, as well as the Food and Drug Administration. Those are the people that regulate, like, you know, food and drugs from the general public. And I'll go ahead and link those references below. So just remember that although the N95 is superior to these two other masks that I've talked about, anything is better than nothing. So when it comes to protecting you, yourself, and others, having something on your face to provide that barrier is better than not having anything at all, because if you don't have any mask at all, that's zero protection. So any protection is better than no protection. That's the key takeaway here. So I hope you guys are staying healthy and well. Hope you guys learned something from this video, and continue to stay home, practice social distancing at least 6 feet away from one another, and only go out when it's absolutely needed to for essential goods such as food, water, things like that. So you guys stay safe, healthy, well, and I'll see you in my next video. Bye-bye. Thanks you guys for watching. Don't forget to give this video a thumbs up, comment, and subscribe, and hit that bell for future notifications.
Tell me pretty lies, look me in the face, tell me that you love me.